Good evening, and welcome to our session on Levi Strauss's approach to mental health, a deeper case study. My name is Ben Miller, and I'm the Chief Strategy Officer at Wellbeing Trust, a US-based national foundation focused on advancing the mental, social, and spiritual health of the nation. My thanks to Zoe and the This Can Happen team for such a well-organized and timely event. Today's panel is a special one. All too often, panel discussions really don't allow us to take a deep dive into companies to really understand what's driving their decisions and their culture. This session will provide us an opportunity to remedy that by looking at one company and why they have chosen to take mental health so seriously and how this mentality has affected the culture of its workplace. And what a time to be talking about mental health. Recent data show that we are all experiencing a shift in our mental health. And what's worse is that we had a lot of problems with mental health prior to COVID-19, which has only made things worse. We've been dying prematurely to preventable causes for the last 20 years. Just to give you one data point, in 2018 here in the United States, we lost 150,000 lives to drug, alcohol, and suicide, what we would call a death of despair. And in 2019, nearly 72,000 Americans died from drug overdose deaths, which is really a 5% increase from the year before. These deaths go up and remain higher than the peak yearly death totals ever recorded for car accidents, guns, and AIDS. And their acceleration in recent years has pushed down overall life expectancy here in the States. In 2020 could get a lot worse. Drug deaths have risen an average of 13% so far over last year, and this is according to mortality data that was collected by the New York Times. And if this trend continues for the rest of the year, it will be the sharpest increase in annual drug deaths since 2016. Research that we've done shows that because of the rates of unemployment, economic decline, and social isolation, numbers around drugs, alcohol, and suicide deaths may only continue to grow in the next 10 years. And it would seem that social, economic, and biological factors are all at play here at once. To give you an example, in one survey, 8 out of 10 workers with a mental health condition did not seek mental health care due to shame and stigma. Divisions divide, and people often don't seek care when they have to work harder for that care or see it as different. Integrating mental health brings it to the places where they are, their workplaces, places like primary care and schools. And it's the workplace that we're going to focus on today. For most of us, we know that we work too much. According to one Harvard Business School survey, 94% of service professionals put in over 50 hours a week. And while some people claim that long hours are necessary to do their job, the science shows us that when we lose work-life balance, everyone suffers the consequences. Many of us currently feel overworked, and feeling overworked isn't just about the number of hours we give up for other things. It's really how much of ourselves we give up every day. Our emotional energy, as well as not even having the patience to address things like familial conflict or the desire to really want to work on that relationship. Some of us may avoid seeking help. The entire country is learning the power of mental health right now. The entire world is learning the power of mental health right now. And COVID-19 has forced us to face a level of uncertainty that most of us have never experienced. So there's no better time than the present for us to begin to place mental health at the center of our priorities and invest in solutions that can help us. Today's a day to be reminded of the power of our employers, what they can do with their voice. It's not a time to be timid on mental health. And as we'll hear, we have opportunities to really embrace other leaders and the innovation that they are pursuing. So what role will employers play, and what's our next best step for mental health? Well, with that, let's get going with our session today. It is my pleasure to introduce you to Kathy Farmer, who is the Vice President of Global Benefits at Levi Strauss & Co., where she's been for almost 8 years. Kathy has a wealth of experience in this space, and I think you'll find our time with her today very exciting. So Kathy, Levi Strauss has been on a journey with how it works to support its employees and their mental health and well-being. Many companies are not taking mental health of their staff quite as seriously yet as you all are. So why does Levi Strauss take that point of view?
Well, first of all, Ben, thank you. And Zoe and It Can Happen, thank you very much for asking for our story. We're eager to share our learnings and our failings as we've been on this journey, because we are passionate about the difference that it can make, not just in our workforce, but in the world. So the question, why? Why are we on this journey, and why do we take it seriously? I would point to 2 different strains of thought. One is the past, historically. Levi's is a company that's over 150 to 68 years old, and it has a long legacy and a culture that was platformed on caring for the well-being of employees. It had a principle in the very, very beginning that what's good for business is good for the employees and vice versa, and we now have codified that in one of our core values called profits through principles. So if you want to read more about it, there's a great book out there called Enlightened Capitalism. There's a chapter about Levi's and how there were always been dedicated to this. But fast forward to the second point of view is to the future. The world that we're all sitting in today, not only the globalization that COVID has made us really come to terms with, but also the competitive environment, the need for rapid innovation. All of these things point to a really high performance workplace. And the mental health and the mental stress of that workforce is organic to creativity and innovation. The data and the science is clear. So in our mind, it's an imperative. And we've been there for a long time, and we're still on track.
So Kathy, I want to ask you just a follow up there. You said the data and science are clear. Well, describe a little bit about what are the business benefits of looking after staff and mental health? Because I agree with you, the data and science are very clear, but we don't see oftentimes employers embrace it at the level that you have. So what are the business benefits that you've seen?
The list is long. And so I would say that it's sometimes difficult for some businesses to get the championship and the financial backing to start some of these programs. But I would be encouraging to say that the data does substantiate this. I mean, you could go simply just to Gallup. It's very clear from all of their data that engaged workforces are more highly productive with better business results. Well, engagement is a reflection of your presence, of your mind. And we do know from some of the research that's been done over the last 10 years is that there's no greater way to destroy your prefrontal cortex, which is where so much of innovation and creativity comes from, than through stressors. I've also been around long enough to see all of the data that's been documented about comorbidity. Unresolved mental health issues for decades and decades have shown us that we see a 3x factor in our medical claims. So companies that just want to be prudent and smart and manage their medical claims expense would be, in fact, paying attention to the mental health of their employees. But what I would say is the most incredibly provoking item for us is that when we started to do health risk assessments and we asked our workforce, what's going on with you? Our data that we collected in terms of the amount of stress and anxiety and depression that our workforce was under was amazing. And I'm glad because it was true. It was transparent. It wasn't hidden as so many, self-reported surveys can be. And we knew that the compelling business case was there to help our workforce and to help the business and the communities that they live in. This is truly a win-win investment.
Well, as a data geek, I can tell you that there's nothing that does my heart joy than talking about making decisions based on data. And you just described a pretty sophisticated and data-driven take on mental health. Could you maybe just go back in time a bit and tell us how you started that journey at Levi Strauss? Were data always foundational to decisions around employees' health and well-being? Tell us a little bit about how you started your approach.
That's a very interesting question, Ben, because my journey with Levi's on this started almost immediately after the day I walked in the door. I think it was less than 6 weeks, and I was invited to meet with the CEO, who was also relatively new, and the CHRO introduced me because he had a mission. His mission was to turn around the company. Great Levi's brand, global recognition, but it had fallen into a bit of a sleep and a slumber. And in the turnaround, he recognized that he was going to need some resilience and some endurance. And his first instinct was to invest in these things in our employees, to invest in their well-being, to invest in their mental health and what they needed for themselves and their families to pull this off, to get through this. It was a very successful 5 years, but it was also an investment. And interestingly enough, the CEO never asked me for data. He intrinsically knew this through his career and his other massive innovations and turnarounds in other businesses. He knew that this workforce investment was imperative. So it was my job to go out and get the data to keep up with him. Now, I know that isn't the typical business situation. I talk to so many of my peers who have structures where they need the data. And for that reason, Levi's was really glad to be out at the leading edge and be able to share data back so that all these other companies can join and get the benefits going, but who need the data to prove it. But it's interesting. Data was not what I was asked for. Data was not what I needed to have the budget, and it didn't take a lot of money. But what it did take was support and championship.
Oh, that's great. And I think that what we've seen across, the world basically is that when there are certain factions that want to embrace mental health, sometimes it does take that champion. It does take it could be the C-suite, it could be somebody on the ground that says this should be something that's a priority. And inevitably, over time, we begin to learn what we should prioritize. And in some cases, we have to learn that as leaders, we have to embrace and really do something about mental health. It sounds like in your situation, there was a lot of insight into the power of embracing mental health from the get-go. And I'm just curious, how have you seen these programs continue to develop over time? You told us a little bit about where you started. I'm curious as to how you've continued to improve and develop and maybe even scale up and scale out some of those programs.
It's interesting. Thanks for that question, because I've been thinking a lot about that since COVID began, because I would say that COVID was almost like a lightning rod for a pivot in this place, and it's welcomed in an ironic way. But to give your question due, we started in a traditional pathway. We analyzed the data, we inventoried what we had, we looked at different kinds of healthcare delivery systems around the world, from emerging and developing to mature. We tried to do a gap analysis and give each of our countries around, the overarching strategic goal, but the opportunity and freedom to shape it for their culture and their country. And all that was great, but it was a program. Okay, it was a program. And programs require refreshing communications, reminders, reinforcement. They actually need champions and modeling to become part of the culture. We have wound our way over the years with, a big launch and a big splash and a lot of enthusiasm and growth and adoption. And then people get busy and things taper off a little bit. And it's just true. It's the nature of people. You need to do periodic refresh and reimagining. But what happened with COVID was really, really interesting, because I think it was a pivot point where all of a sudden I realized that instead of it being a push, it was a pull. And almost overnight, even in a culture and a company that deeply embraced this, the demand was for mental health tools and support managing for a leadership team who was faced with an unprecedented global challenge. I guarantee for you and any of the folks listening right now that there isn't a C-suite on the planet that had a business school playbook for COVID. And they recognized that they needed to keep their own mental health up, because they were then in turn leading their teams. And they wanted to have for themselves what they needed to give to their leaders so that they could, in fact, lead all the way through the business. Because I think overnight, everyone realized what was going on with mental health. And sometimes we deal with stigma. There are places in this world where the stigma around mental health is stiffer than in other places. There are resource limitations, even in wealthy countries. There are access issues and other kinds of challenges, but almost immediately, what we found was that it became no longer a program, but a culture. Or it was diffused throughout the culture, is maybe a better way of saying it, because it was so present and it was so prevalent and it was so real and it was so essential. It was mission critical. So what I really love about our journey is that essentially what I think where we are right now is that the years of shaping the program and the coincidence of world events have coincided to a place where now it's actually almost an infusion into the culture. Because you can imagine, there are all different kinds of tools, techniques, policies, and ways of working that support mental health, and they are broad. And so they have to be diffused across the entire business.
Well, I want to ask you a little bit about this culture piece, but more specifically about the obstacles that have come probably across your desk at some point that have really made it difficult to pursue some of these strategies you just described. I mean, you mentioned one, stigma. I mean, stigma, looking at the literature, is really both social and structural simultaneously, right? It's how we talk about it, how we relate to one another, but it's also structural in the ways that we reinforce, what is technically okay for mental health and what is not. And for a lot of employers, these become barriers, big barriers. And so what barriers or obstacles have you come across in your journey at Levi's?
Many, and they're varying. So I want to make certain that we're addressing this on a global basis because I think they can vary by country and culture. So let's take a number of years ago when we decided that we were going to launch a global EAP. We knew that in some countries that was going to be supplemental access to counseling and mental health. It might be, lower level services to avoid more serious things. It might be the beginning of a longer journey. But whatever it was, we knew that in some countries, it was the only mental health access that people had. It just wasn't existing and it wasn't prevalent. And if you have certain social systems, it's very limited. So it was a very uneven playing field. And it was our intent by bringing in the EAP to kind of level the playing field. Now, in some countries, even though the need is high, the willingness to use the service is constrained by shame or social stigma or an inability to acknowledge that this is a real problem. And I'm talking about a culture, if you want to have a point of perspective, where in the 70s, Levi's took a very radical, progressive stand in terms of HIV/AIDS. Back when it was in its very infancy and there was a lot of stigma around it. And Levi's took a very strong position about championing for research and for treatment and for normalizing it. And we still recognize World AIDS Day all around the world. So while people can embrace all that goes along with that, to think that a mental health issue had a stigma was something that we had to grapple with. We did a lot of storytelling. And we found that storytelling is a very powerful way to try to normalize what I call the distance between the head and the body, which is the 2 inches of the neck. There's really no difference. So we've had challenges, but we've persisted. And that's one of the things that I think really makes the difference. Our commitment is authentic. And I saw a survey once that was really fascinating. It was a slightly different topic. It might have been about companies embracing social causes. And the number of respondents who indicated that their company did that was like in the high 90s. 95% of companies declared some kind of adherence to a social mission. And then they asked the employees how many of them believed that it was authentic. And that number was like in the 30s. So I'm just here to say that whatever the topic, the workforce has got very keen radar as to whether or not this is just another cookie cutter, stamp it out program, or this is something authentic in the culture. And that's what we've been driving for, is the authenticity for people to feel that when they have stress or they have anxiety or they have more serious problems, either for themselves or for their family members, that these don't need to be isolating factors, that they can in fact embrace a lot of different tools and services. And they can also connect with other employees through employee resource groups or take the time that they need and be able to tell their managers in a flexible work environment, that they're taking care of their mental health.
There's probably a lot of people watching this, Kathy, that are thinking, I want what she's got. I want what they've been able to figure out. And it seems like as you keep describing this journey around the integration of mental health into your overall company culture, that leadership plays a really important role here. So if I'm an employee and I'm thinking about my business and I'm saying, it doesn't seem like mental health and well-being the way that Kathy's talking about, how important is it for me to try and get my senior leadership to buy in to this idea that mental health should be embraced as an employer? So to you, I mean, how important was it that senior leadership almost from the get-go seemed to be willing and able to do something about mental health?
Well, and we have found that championship and leadership was essential for us. And my hope is that in leading in this area that we can then turn around and share that so that the enormity of what it takes to get this done in other cultures and businesses isn't such a high bar. But at the time, if you want to go back about 8 years, while mental health was an important issue, I don't think that it was top of radar for many companies. And our CEO shared once that he was at a Fortune 50 session with other CEOs, and he was sharing his views on this, and almost every one of them agreed from their own personal experience of how important our entire well-being, including our mental health and management of stress and anxiety and depression and other issues. It's not just entry-level issues. There are people who have all kinds of diagnoses who are contributing, creative, productive members of our workforce. And they needed to be treated with access to resources and respect as well. One of the things he shared was that a lot of the other CEOs were saying that what they were looking for because of their boards was the ROI, the financial ROI. And so I think that's where we're all trying to come together with the data now to be able to pave the way. But in our case, it was my CEO that stood up and said, no, we're not going to cut this budget. We're going to cut some other budgets, but we're not going to cut this one. Not that we were egregiously spending, but it was also his commitment to his executive leadership team. They knew that he was serious about this. So then when they returned to their Asia or their European or their Latin American areas of influence, they carried that message. And as they carried that message, it was giving more and more people permission to be able to deepen our commitment to this. And so I think it was very important.
Well, one of the things, I could ask you 1,000 questions about this because there's so much in what you're saying that I'm sure folks want to unpack. So I want to hang with this. I'm thinking about it from the point of view of an employer who's trying to pursue the type of journey that Levi's has gone on. So when we talk about innovation, which is an overused term, but I'll use it here anyway, there's this term I love called exnovation, and it's really about taking away innovations to allow for another innovation to thrive. But the only way you can do that is by learning along the way, figuring out what works, what doesn't work, and getting rid of some of those things, sometimes that work, but not as well as something else, sometimes getting rid of the things that don't work altogether. And that takes a lot of time and a lot of understanding of what's the programs and the culture itself. So what would you say are some of the most important lessons that you've learned along the way?
I would say that for the corporate leadership on this, to get out of the way. The biggest lesson, because what I have found, which I thought was very rewarding and refreshing, is that once we laid out the strategy, the structure, the championship, the support, and the goal, when we decided that we weren't smart enough to know what was going to work in every country and every culture, and what we did was embrace almost a grassroots, bottoms up approach to this, we gave extraordinary leeway and creativity and opportunity for this to be designed in a million different ways. And it was. It was. If you take a look at mental health as being part of the larger structure of employee well-being, and all of it was embraced together and championed together and supported, then that meant that in Russia, it looked very different than it did in Singapore. And I got to tell you, Mexico did an incredible job. And yet in the UK, there was just a little bit of a different attitude or approach to it. Nevertheless, in Poland, we had some local champions and some people who were passionate, who spread the word amongst themselves and created some really incredible ground up work. And I could never have done that. Corporate could never have done that. Corporate could champion it, could structure it, could pave the way. But then I really believe that once you've got your structure ready and poised, and you've got the right engagement level, you need to let go. You need to trust the people in the local countries or in the local cultures about what's appropriate there. Japan is a very different place for us than is San Francisco. Go figure,
Go figure. Well, I want to talk about you for a second, because I hear you describe these amazing programs and things that you're working on, but we know that employers play a unique role in not only providing most of our health insurance through our benefits, but also, the place where we spend most of our time. As I mentioned at the top, we're there a lot. There's a culture that often gets established by senior leadership, including yourself. And as a senior leader for Levi's, how do you personally model good mental health?
That is everything right now, everything. And it's in part because it's authentic. And as we have found, the authenticity is what really permeates the trust that this is real. The trust that people are willing to then engage in services that they might need without fear of reprisal, or that their employer is peeking and watching and there's punitive action behind it. Or trust that, it can be talked about openly in the culture. All those things are, I think, based on the authenticity. And the authenticity comes from, I think, admitting our humanness, our humanity, which, by the way, includes a lot of failure and frailty. Hard as it is to accept all these billionaire successful people who like to tell us a story about how they failed 17 times before they succeeded. When we fail, it is really hard to get back up and admit our humanity. And that's the way I think that I've been trying to model, especially recently in the mental health arena. I'm in the HR function, and HR functions around the world went into hyperspace when COVID hit. And even though we've been working from home, the commute to the computer, to the laptop might have been 10 seconds, but the day was, eternally long, 18-hour days, 16-hour days, no breaks, and a lot of anxiety and uncertainty and a lot of pressure to deliver. And so here's what went on. All of us suffered, as you said, from our mental health. And I have a team, and my team works with teams, and we rub shoulders cross-functionally with other teams. And everybody is doing the best they can, but admitting to my teams how I'm trying to manage for my stress goes a long, long way. It essentially models the behavior that we really feel strongly in. In fact, we just launched a global program a couple of months, not more than 2 months ago, called Seamless. And it's an acronym, because of course our corporate world needs another acronym. And it stands for SEAM, SEAM, support, engage, adopt, and model. And the modeling is really, really important for us because it paves the way, as I said, for it not to be a program, but to be a part of the culture and about the way we work and the way we support one another as we go towards the business goals.
Well,
So how do I lead?
Yeah.
I lead by encouraging others to take the time that they need. And I also admit to my team when I haven't taken the time that I need, and I admit it and I call it and then I confess it and I take it.
Very wise words. Well, Kathy, we're getting a lot of questions from folks that I want to start to throw at you, but let me ask one final wrap up from my questions, which is there's a lot of people on here that are at various different stages of pursuing a mental health strategy. And so if I'm an employer looking to start my journey with mental health, where's the most important place to start? Especially if they may not be a multi-site global company like Levi's. Are there resources or other examples we should look to, or just what's your top 3 places that maybe we should start?
Absolutely. Not There aren't barriers to this like big projects with big money. I would say start where you are. Take an inventory of what you have. We started there and we were surprised that we had more than what we understood or realized. Leveraging what you have and communicating what you have is a wonderful way to start. A gap analysis based on what you have also lets you prioritize what you think are the most important things to focus on. And there are plenty of resources, NGOs and nonprofits and educational and intervention-based resources in all countries around the world. So I would say that I would try to look there as well, because all of those things can be very effective and they're very low barrier to begin with. The other thing too, and we learned this, I mean, we did a massive study and we set the structure, and then we learned that our countries had lots of really good ideas. And so I would never pass on the input from people who are passionate about this area, who want to volunteer or share ideas and suggestions. It's also a really ripe opportunity.
Well, Kathy, thank you. Our audience has put in a ton of questions, and I'm going to just kind of pick off a few with the time that we have here. So let me start with the first one, which is what is more important on spend and budget on what is more important, spend or budget on mental health, or a changing attitude to creating an environment where people can talk about and support one another on mental health? And if it's the latter, what are the minimal areas of well-being that you might suggest?
I think that's a great question, and I am inclined to say that it's the culture and the freedom and the flexibility and the endorsement of humanness that we all deal in. But I will also tell you that we look at mental health, if you will, on a ladder. I'm keenly aware, Ben, too, that there's data out there that supports that almost all of the early mental health issues can be resolved if they're addressed early rather than letting them fester. And so when you talk about that question you just posed and the whole culture and the attitude, that's basically at the base of our approach to this. It's very widespread, it's very broad, it's very accessible. It has lots and lots of education, information, flexibility, support, and cultural champions. But as you go up the ladder, you have to realize that for some people at some points in time, things can become more serious. And they can require additional levels of intervention and treatment. And so it's very important to also have those two. We just believe that you can optimize the more serious things that you need to invest in if you have this broader culture of acceptance and accessibility.
I remember a former CEO was talking to me about their investment in mental health, and they weren't at the time investing anything in mental health. And one of the employees said, "You know, you're already paying for this; you just don't realize it. So by putting money towards it, you could actually do a tremendous good for not only your own bottom line, but for your employees." So I think that's very well said how you just articulated that. Let's talk a little bit about nutrition and some of the other facets that we know go along with overall mental health and well-being. And so the question in particular was, have you integrated nutrition into your mental health strategy because of the link between good nutrition and good mental health? Anything you want to comment or say on that?
Great question, because we do believe and we have a program that embraces all aspects of well-being. So physical, which means physiologically, but also nutrition, exercise, sleep, all those things that are really fundamental to the health of our bodies and our brains. There's really, as I say, this 2 inches is really not a barrier. It's all the same biochemistry. So we have a program that also embraces what you might call more of the social dimensions of well-being for mental health, and that is connectedness and community and even service. We have a long history of dedicating our time and energy as a company to helping others. We get out all around the world one day a year officially and many other hours unofficially to do good service for other people. And we believe that the holistic approach is the best one. So our mental health is all about our physiological health, our emotional health, our social health in terms of connectedness and giving as well.
Thank you for that. One of the questions that came in, I think, is a fascinating and challenging one here, and it's asking about if you have a key value around mental health or well-being that allows for a conversation to occur when you hear comments or conversations, or maybe perhaps you see an email where positive mental health and well-being is not being demonstrated. And I think the question is really getting at, like, what happens when you see something that works against positive mental health and well-being? What do you do about it? How do you address that as a company?
Great question, because I have a perfect example real time right now. So we do have core values and we live them. Okay, they are authentic. So respect, empathy, and integrity are the three that come immediately to mind when you're talking about mental health issues. But one of the things that started to come to our attention was that when we started working remotely and we had more and more mental health or mental stress issues, people's productivity time online was just long, and stress was way up. We knew the data from domestic violence, suicide, and other things that were going on during the beginning of COVID, and we were quite concerned about that. We decided that more flexibility in the work style and the work days was really important to people's mental health. So we started adding an additional paid day off once a month. We stopped meetings on Fridays to be able to let people just kind of breathe and have more flexibility. We also then wanted all of the managers to understand that they were going to need to manage with a certain amount of flexibility to allow people's stress levels to manage whatever they needed to do, whether they were educating their children or whether they were caring for elderly parents or somebody who was ill, or even if they just had their own mental health issues. And what we found was that the manager skills, in order of trying to have that much flexibility doing this remotely, that their skills were uneven. Some were really good at it and others just didn't really know how to do it. So what did we do? We actually launched a global manager reset training. And we're just in the probably about 2/3, 3/4 of the way of rolling it out to really help support the managers so that they have the skills and resources available so that they can manage in a way their workforce that gives them more flexibility and breathing space. So that's a classic example of when the values are there and yet it's not executing, following out exactly how we want it to be. Then what we do is we try to source the issue and correct for it.
Well, we've got about a minute left, Kathy. I want to give you one more question and then I'll wrap up here. So let's give you just a couple of opportunities for this one. What factor does diversity and inclusion play in your mental health initiatives? And if you could do this in the next 30 to 45 seconds, sorry to rush you there, I think that would be wonderful. That's a big question.
It's huge. All over Europe, we have diversity of religion and culture that is very important to people. In the United States, with some of the racial tensions that we've had this year, we're cognizant that there are some needs in mental health for certain segments of the population that are unique. we have been committed to diversity and inclusion for a long time. On the other hand, we recently learned that, like everyone else, that we could do better and we could do more. So we are absolutely looking at all of our programs through the lens of diversity and inclusion. It's not just necessarily race or gender or religion. It could actually be physiological limitations, or it could be even ways of thinking. We think there's tremendous power in the inclusion that diversity brings to business.
Well, with that, Kathy, I want to thank you. Thank you for giving us these insights today, for your experience, but most importantly, for being a leader. This problem's not going to solve itself. It's going to take all of us. And so to that and for many other things, I thank you for your time this evening.
Well, Ben, thank you for your questions, and thank you for all the work that you do in your organization, because I really think it's going to take the Army, but I'm encouraged. I think that there's a lot of progress being made. So I wish well to all of you.
Thank you.